It was mentioned before about frailty and the condition and survival. And this is part of a talk that I always put in my talks just to show everyone is that, as neurosurgeons, even though for neurosurgeons, whether you're dealing with GBM or metastatic disease in the brain, we're not really that in tune with what's going on in medical oncology, right? So we go to JNS, CNS, we're not going to like ASCO and, all these other cancer meetings. And it's very hard to keep up with what is going on in medical oncology, especially with these targeted agents. And with renal cell carcinoma, the cancer therapies have really taken off in recent years, okay? And literally in almost every month, there's some new article or paper in New England Journal or Nature or Science about some other targeted therapy and some other immunotherapy on an application of some type of agent. And the problem is that, in a lot of these cases, the patients who have bone metastases or spine metastases have actually been excluded from these trials, right? So that's why when it comes to our doorstep and we're thinking, hey, should I operate on this person or should I send them to radiation? And we're looking for evidence to give us some guidance. Well, and we ask the medical oncologist, hey, like how long is this person going to live? And they'll say, oh, they're going to live for a year, or they'll be great. You should operate, right? But when you look at their actual clinical trials, they've actually excluded a lot of these patients. So that's why it's very difficult for us. And that's why in neurosurgery, you're going to see papers. We've written papers about it. Other people have written papers about it. Neurosurgeons have taken upon themselves to try to develop their own predictive sort of analytics to try to determine like, hey, what can we come up with as surgical decision-making tools to help us decide whether to operate or not, And so you'll see that as a neurosurgery, JNS Spine. And we've critically looked at that. We had a paper just in JNS Spine last month where we looked at all our renal cell cases and we looked at all the different historical predictive analytic systems that have been developed, and they're all pretty bad, because they were designed from retrospective series, small data sets, and that's part of the problem. So as much as we'd love to say that, we can predict to a very certain degree, it's just not there. And what I'm trying to show here is that with medical therapies, more than 10 years ago, if someone had diagnosis of metastatic renal cell carcinoma, their survival was 13 months. Now their survival is much longer than that, okay? We did our own analysis, and this was published in JNS Spine just a month or two ago, looking at our RCC cases, and we showed that actually when we operated on patients and started them on systemic therapies, their overall survival was significantly longer, 913 days. This is versus a historic 222, okay? So 900, it's a couple of years, almost 3 years, okay? And what we found too is that when you look at it based on their KPS, okay? So yes, you could say that, well, someone with a higher KPS or functional status, they're just gonna have a better outcome overall, right? So that's what you see in dark blue. KPS greater than 80 plus postoperative adjuvant therapy, yes, their survival is better, right? But now look at this. The KPS less than 80, but with adjuvant therapy, their survival was actually better than the patients with KPS greater than 80, but without adjuvant therapy, okay? And again, this is actually a combined cohort with MGH and the Brigham, but this is 87 patients at 2 major medical centers, retrospective analysis, and it does account for multiple different practice patterns. So there are always issues with selection bias. There always are in retrospective series. But this was one of the first studies of the kind to kind of look at this determination. So that's why there is some value there.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.